Have you ever found yourself reading about the different Medicare enrollment periods only to feel like you're staring at an unsolved Rubik's Cube? If so, you're not alone. But luckily, in today's video, we will help you solve that puzzle by breaking down the important Medicare enrollment periods that you need to know by explaining each one in detail, and we will provide real-world examples to illustrate how each one works. Now, before we dive in, my name is Cameron Giardini with Giardini Medicare, and I do want to point out that today's video is specifically designed to discuss the enrollment periods for both Part A and Part B of Original Medicare, and this is for those of you enrolling in Medicare at age 65 or older. Now, if you are eligible for Medicare under age 65 due to disability or certain other health conditions, we will have other videos in the future discussing your unique circumstances. So whether you are approaching your 65th birthday or you are helping a loved one navigate their Medicare choices, this video can be your starting point. But please make sure you do not miss part 2 of this video highlighting the various enrollment periods for Medicare Advantage plans, Medicare supplements, and Part D coverage, and we will be releasing that video in a couple of weeks, so please do not forget to subscribe so that you are notified when that video is released. Let's start by quickly understanding the foundation of Medicare coverage, which is known as Original Medicare. This is divided into two parts. That is Part A, often called hospital insurance, which provides coverage for essential services like inpatient hospital stays, skilled nursing facility care, hospice care, home health services, and more. Part B, on the other hand, is the other side of Original Medicare, and this is medical insurance, which covers outpatient care such as doctor visits, preventive services, medical supplies, and much more. Now, together, these two parts form the core of what is known as Original Medicare or Traditional Medicare. But now that we understand those basics of Original Medicare, one of the most critical times for anyone approaching Medicare eligibility is the Initial Enrollment Period, or IEP. We'll use a lot of abbreviations in this video, so just know IEP in this case is the Initial Enrollment Period. Now, this is the 7-month window that starts 3 months before the month you turn 65. It includes the month of your 65th birthday, and it extends 3 months after the month you turn 65. Now, for most of you watching this, this will be your first opportunity to sign up for Medicare Part A and Part B, and it is a period you need to understand. But before explaining the IEP in more detail, we do want to let you know that you now can access a full list of our educational Medicare resources and get free personalized one-on-one guidance if you would like, and you can do this by going to our website doineedmedicare.com. You can do that after watching this video. So fortunately or unfortunately, your IEP, it is often relatively hard to miss this enrollment period because this is generally the reason that advertisements in the mail, online, and your TV will bombard you as you approach age 65.
Lot of spam calls lately?
Since this is when everyone knows that you're approaching Medicare eligibility, likely for the first time, and you have an important decision to make. Diving deeper into understanding your Initial Enrollment Period, or IEP, let's talk about why timing is everything. So if you enroll during the 3 months before you turn 65, your Part B effective date will be the first day of the month you turn 65. For example, we will look at William. He is turning 65 on September 18th, meaning that he is eligible for Medicare Part A and Part B effective September 1st. So if William applies for Medicare in June, July, or August, both his Part A and his Part B effective dates will be September 1st. However, if you wait to enroll in Medicare during the month you turn 65, or during the 3 months that follow your 65th birth month, your Part B effective date would be the first day of the month following when you apply. So if William were to apply during September, his Part B effective date would be October 1st. If he applied in October, his Part B effective date would be November 1st, and so on. Now, as a special note, when you apply for Part A after age 65, the effective date is retroactive up to 6 months from the month you apply, but it cannot be sooner than when you were first eligible at age 65 in this case. So for William, his Part A effective date would still be September 1st when he was first eligible, even if he applies in those few months after when he turned 65. As a reminder for those of you watching this video that happen to have been born on the first day of a month, your IEP, it does start 1 month earlier than for others. So if your birthday is August 1st, for example, you are technically eligible for Part A and Part B effective July 1st. And your IEP, the timeline of it essentially shifts 1 month earlier, so it would actually run from April through October. Now, this is a somewhat small small detail, but it has significant implications on your coverage start dates. So be aware. When it comes to enrolling in Medicare using your IEP, if you're already receiving Social Security or Railroad Retirement Board benefits at least 4 months before turning 65, you'll be automatically enrolled in both Medicare Part A and Part B, effective the first day of the month you turn 65, and this will be a very seamless transition. However, if you are not receiving these benefits, you must manually and actively apply for Medicare if you do want it to begin when you turn 65. Now, this can be done online, over the phone, or in person at your local Social Security office, although the online application method is generally our preferred method, which we will highlight step by step in future videos. Now that we have gone into more detail about the Medicare Initial Enrollment Period, we have to address the elephant in the room.
Wow, elephant in the room.
That is the fact that many of you watching this video, you won't actually have to have Medicare beginning at age 65 using your IEP. Seemingly, it is becoming more common than ever to delay Medicare beyond age 65, and this is due to having employer group health insurance through your or a spouse's active employment at a company with 20 or more employees. So if you find yourself delaying Medicare past age 65, what enrollment options do you have? Well, for those who let their initial enrollment period pass them by, there is still a very important enrollment period that will likely be available to you, and that is known as the Part B Special Enrollment Period, often just shortened to your Part B SEP. Now, according to the Social Security Administration, this special enrollment period occurs during any of the months you are covered by group health insurance based on current employment status, and according to SSA.gov, the special enrollment period lasts for 8 consecutive months following the last month during any part of which the individual was enrolled in the group health plan based on current employment status. We will link to this guide from Social Security that you can see here on the screen about the Part B SEP. This is excellent to read if you are having any trouble falling asleep. Also, since we will talk about Part B for much of this video, just know that if you're eligible for premium-free Part A of Medicare, you can enroll in Part A of Medicare anytime you choose after age 65, and many people will still choose to enroll in at least Part A of Medicare during their IEP at age 65, even if they plan to continue to delay Medicare Part B due to having active employer coverage. However, those that want to contribute to a health savings account while working often choose to delay both Medicare Part A and Part B of Medicare, which we will highlight more later in this video. So with that being said, here is an example to better understand the special enrollment timeline. We will look at Kim, who delayed Medicare Part B past age 65 due to having proper employer coverage and then stopped working. And in this case, Kim's coverage ended at the end of November. This means that Kim's Part B special enrollment period would continue for 8 months following the month of November, which would be from December through July of the following year. However, this is important. Just because this Part B SEP can last up to 8 months after your employer coverage ends, it does not mean that is when you should plan on enrolling in Medicare Part B. In reality, you will want to be proactive and apply for Part B using your special enrollment period up to 3 months before your employer coverage actually ends, which you can see as possible as stated on the Form 40B, which is the actual application for Part B. So going back to Kim's example, instead of waiting for December when her employer coverage has ended, she can instead enroll during September, October, or November for a Part B effective date of December 1st to prevent unnecessary gaps in her Medicare coverage. Typically, the easiest way to choose your Part B effective date using your SEP is by writing your requested effective date in the remarks section on the paper Form 40B, which is the Part B application, or you can do this in the remarks section on the online form if you instead want to use the online Part B SEP application, and we will link to that application below. Just know that if you do apply for Part B for some reason in the last 7 months of your special enrollment window, you will not be able to choose your Part B effective date, and instead it will be effective the first day of the month after the one you apply. Also, if you are applying for both Part A and Part B after age 65, your application process will be slightly different, and again, we will highlight this in a future video. Last but not least, when talking about timing, it is important to remember that if you are also enrolling in Part A past age 65 when you apply for Part B, again, your Part A effective date will actually be effective 6 months retroactive from the month you apply for coverage, which is what we mentioned a little bit earlier. So for example, if Kim enrolls in both Part Part A and Part B in October, she could request her Part B become effective December 1st, but she would not be able to choose her Part A effective date, and it would instead likely begin going back to April 1st. Here on the screen, you can see an example of an actual Medicare benefit verification letter showing a retroactive Part A effective date. Normally, this is a pretty small detail since most of you watching this will not pay a premium for your Medicare Part A, but as you can see here on Medicare.gov, if you are contributing to an HSA, this will be very important for you to know, so make sure you watch this video you can see on the screen about how to handle Medicare with HSAs for more details. Now that we have discussed the Part B special enrollment period in detail, here are some additional pro tips that you should know. First and foremost, to use this SEP to enroll in Part B of Medicare, you will have to show proof to Social Security that you were covered by active employer coverage after age 65 with no more than an 8-month gap in that employer coverage. Now, this proof, it is often best done by using the CMS L564 form, which your employer actually completes to confirm your health coverage. Just know that if you have had employer coverage from multiple employers at age 65 or older, you will need to get the form filled out by each of those employers that you had to show that you've had continuous coverage. If for some reason you cannot get a completed form L564, you can also use one of these other methods that you see here on the screen to prove that you have had proper employer coverage. Now, another tip is for those of you retiring close to the month you turn 65. In this case, the enrollment rules and the timing for your IEP, they take precedence over your SEP for leaving employer coverage. So let's break this down. For example, if your 65th birthday is on May 5th, your initial enrollment period, it spans from February to August. Suppose in this case, you are losing employer coverage at the end of June and you need Part B starting July 1st. Now in this scenario, you should apply for Part B in June since you are in the last 3 months still of your IEP. So your coverage, it will actually begin the first day after the month you apply. If you try to be proactive and you apply 3 months before July 1st, like in our previous example, this would mean that you would be applying in April. And even if you try to choose July 1st for your Part B effective date, it will default to that IEP timeline we talked about earlier, and instead your Part B would be effective May 1st. Also, when it comes to a timing pro tip, it can be very important to know that if you sign up for Part B using the SEP during the first full month when you are no longer covered by your plan, you can actually request your Part B effective date be the first day of the month you apply. So for example, if you find yourself unexpectedly losing employer coverage at the end of April and you aren't able to apply until May, you can still apply for Part B using the SEP in the month of May while requesting the effective date actually be May 1st to avoid gaps in coverage. Now our last pro tip is that it is important to note the differences in the Part B SEP eligibility concerning coverage through a domestic partner and COBRA. Unlike employer coverage through a spouse, being covered under a domestic partner's plan at age 65 or older, it does not qualify you for a Part B SEP for leaving employer coverage, as you can see here in the Social Security regulations. And while COBRA coverage extends your employer-sponsored health coverage after your employment ends, it does not extend your Part B SEP. The clock for your SEP starts ticking the moment your active employment or employer coverage ends, not when your COBRA coverage expires. Now, if we had made this video a couple years ago, this would likely have been the end of the Part B SEP discussion. Now, although the SEP for leaving employer coverage is still the most common, it is not the only option you may have for a Part B special enrollment period, because in January 2023, the Bennies Act implemented new special enrollment periods, or SEPs. These are designed to accommodate individuals in specific situations that were not previously covered. Now, these new SEPs, they cater to a variety of circumstances, which include individuals impacted by an emergency or natural disaster, misrepresentation by a group health plan or employer, also termination of Medicaid eligibility, those that were formerly incarcerated individuals, and others experiencing exceptional conditions. Now, we can't get into all of the details about these specific special enrollment periods since that would take way too long.
This is taking taking forever.
But we will link to the specific rules and regulations for each of these new SEPs in case any of them might apply to you. Just know that the form to apply using these SEPs is the form CMS 10797, which you can see on the screen, and it also does a good job of explaining the different enrollment periods that were newly created. Lastly, although this is not one of the new Part B SEPs, since we hate leaving out details, as you know, just know that there may also be an SEP for international volunteers and certain TRICARE beneficiaries, as you can see here from CMS on the screen. Now, moving on from special enrollment periods, let's talk about the final enrollment period associated with Original Medicare, which is the General Enrollment Period, or GEP. Now, we often view this enrollment period as a period of last resort because it should really only be used by individuals who have missed their initial enrollment period and do not have access to a Part B special enrollment period. Now, the GEP, it occurs annually from January 1st to March 31st, and again, thanks to changes from the Benny's Act we previously mentioned, if you enroll in Medicare Part B using your GEP, your coverage will begin the first day of the month following the month in which you apply. This is a big improvement from the past when individuals enrolling during the GEP, they would not have their Part B become effective all the way until July 1st of the same year, but again, luckily that is no longer the case. Just as a quick example of this timeline, if you apply for Part B using the GEP in January, your Part B would be effective February 1st. Applying in February would result in a March 1st effective date, and so on. However, being aware of the potential penalties associated with late Medicare enrollment is important if you have to enroll using the GEP, since generally if you apply for Medicare Part B after age 65 without qualifying for a special enrollment period, you may face a lifetime Part B penalty if you go more than 12 months without Part B coverage when you should have enrolled in it. Thankfully, you can watch our recent video we made to learn more details about various Medicare penalties, and thankfully, since you watched this video, you really should not have to worry about these. If you have any other questions about the enrollment periods that we talked about in this video, please make sure to comment them below or use the link in the description below to connect with a broker. Don't forget to subscribe to our channel and click the bell so you can be notified when we release our next video about Medicare Advantage, Medigap, and Part D enrollment periods. And then next, you can watch this video that YouTube suggests for you.